Hi, I'm Jim Fazzackerly. I'm a public safety veteran and an instructor with years of teaching in CPR, first aid, and disaster preparedness. I'd like to talk to you now about what to do when you're faced with a first aid emergency. And there are just a couple of general rules that will work for almost every situation. So why don't we start with that? First of all, there are some really common first aid emergencies, and I think we should focus on those. And there are basic steps. But today we'll also talk about the emergencies that might happen to you most commonly, such as breathing problems, bleeding that you can see, and also potentially broken bones, along with people who have become unresponsive to you shaking and shouting. And I'm also going to tell you a little bit about where to learn more about first aid. Why don't we start with basic steps? So in any first aid emergency, the number one priority for you is to make sure that you are safe. So whatever area that you're going to be working in with the victim, you have to make sure that there are no hazards, no threats that are going to injure you or potentially make you unable to help others. The other thing is you want to always check with the victim and find out, are you okay? You literally want to ask them, are you okay? And then also ask them, can I help you? Is it okay if I help you? And then you want to see basically if any victim is breathing. That's very basic. And you can do that by looking at their skin. Does it look like a normal pigmentation, or is it very pale or very sweaty? Also, you may notice there might be some bluishness around their lips. That could be a clue that they are not breathing well. The other major sign is whether or not their belly or their chest is moving up and down in a regular way that people would when they're breathing normally. So you want to check on that. You also want to look for any signs of injury on a person. That might include areas of bleeding that you can obviously see, or areas where there's an unusual shape to the bones, as if there might have been a dislocation or a break, as well as obvious things like a burn that you would notice. And then when you're looking at your victim and trying to figure out what's wrong, it's helpful to see, do they have special jewelry for medical alert information, usually on the wrist or around the neck, or sometimes even around the ankle. You'll see a little bracelet. So if you can do all of those basic steps along with one very important additional one, this victim is going to be a lot better off. The one most important step is to keep that victim warm. Don't let someone become cold once they're unable to move and they've been hurt or they are ill. And that can be done by simply putting a blanket or two or some heavier jackets and clothing on top of a victim who's lying on the ground or in the street or even on a couch. Now, when it comes to specific emergencies, there are a couple that are pretty common and that we should go over. The first is breathing problems. It's a very common problem and it has many different sources, but there are some basic first aid principles that we can apply in every given situation. The first of all is, as always, make sure that the area is safe for you to try and help this person. And then the other thing is to see if you can get that person to sit up straight or sit up from a lying position to help their body with the work of breathing. That's also very important. You can ask this victim, do you have any medicine for your breathing? And if they know, you can go to a medicine cabinet or sometimes even to a refrigerator and bring those containers to the victim so that they can take the medicine themselves and help their situation. Another important thing is to call 911. If someone is having a difficult time with breathing, it needs to be checked out. And they aren't always able to even tell you to call 911, so you may have to do it for them. And there are some basic things that you'll need to tell 911 that we'll go over in a little bit. Once you make the phone call, stay with the victim. Do not leave until more advanced medically trained personnel show up onto the scene. And then finally, be prepared to do CPR if necessary. Even hands-only CPR is an excellent way to keep somebody in a viable condition while help is on the way. Now, if you don't have a breathing problem, another common emergency that you might run into is bleeding that you can see. And there are just a couple of basic principles that you want to really stick with to make that emergency become much less severe. So again, as always, make sure that the area that you're going to help this person in is safe for you to even be in. And if you can, to go and get a first aid kit from wherever it might be stored. Maybe in your automobile, maybe it's up in a cabinet, but a good first aid kit can be your best friend in this kind of situation. So for bleeding that you can see, you'll probably want a nice big bandage that you can peel apart and actually put onto the bleeding site. And that's done by peeling off the paper on the bandage. And this could be, by the way, a clean cloth. It doesn't necessarily have to be a store-bought dressing. So if you need to, you take a clean cloth and you wrap it up and then just apply pressure right onto where the bleeding's coming from, right on top of a wound. You keep the pressure on for 5 minutes with no peeking because you don't want the bleeding to start up again. So firm pressure with your hand is usually enough to stop most bleeding, which is good news. Now, if the bleeding does not stop, it's important that you not just pull off the dressing. You want to take a dressing like this and add an additional dressing on top of that with firm pressure to make this work. There are situations, a small number of them, where even doing firm pressure is not enough to make the bleeding stop. If the bleeding is so severe that it is soaking through all of the bandages that you put on already, or if the bleeding is the type that sprays a little distance because it's coming from an artery under pressure, you may need to actually apply a tourniquet to that person. And we're going to see how to do that in a minute. But the basic things that you need for a tourniquet are very simple. You need a stretch of cloth that can be about 2 inches in width. And you also need something firm to tie the tourniquet with, such as a screwdriver. That works great. Or even simply a firm stick can be enough to do that with. So tourniquets, while they are rare and we don't want to resort to them unless we have to, they are life-saving. And then finally, you want to call 911. If you have bleeding that is serious, you want to make sure that advanced help arrives on the scene. So with those things in mind, then we're going to go ahead now and tie a tourniquet. And you can see step by step how we do that. So if it comes to the point where you've been trying to control bleeding with direct pressure, but it's not working and the dressings are soaking through, or it's the type of bleeding that is spraying across, then you need to move to a tourniquet. A tourniquet can be made out of various different materials, and probably one of the easiest materials to use is a simple waist belt. You can use a belt and wrap it around someone's arm or leg and simply put one loop in through the buckle and tighten it and then secure it. But the key is you have to tighten it enough so that there's no further bleeding coming. Let me show you how a traditional tourniquet works using some very basic materials. What you need to make a traditional tourniquet is just a piece of cloth, in this case an old t-shirt might do, and you want to rip it so that it has a good deal of length. Ideally, the cloth is between 1.5 to 2 inches in width, so it's a nice long and wide piece of cloth. Then you're going to wrap it approximately 2 inches above the wound, or at least 2 inches above the wound. Once you wrap it, it's time then to tie the cloth together. And then you're going to take your next tie and tie the stick or the tool that you're going to use to twist the cloth with. We sometimes call that a dowel. So we're using a screwdriver because that works really well and it's easy, most households have one. And I'm going to tie up the screwdriver so that it is also tied to the tourniquet. Now remember, this has to be done fairly quickly. Now that the tourniquet is secured to the the screwdriver is secured to the tourniquet, we can begin to twist. And as we twist, we're waiting until bleeding stops entirely from that victim's arm. Once the bleeding has stopped, we want to take the rest of our tourniquet tail and create another knot across the arm so that it keeps the screwdriver from spinning loose and making the tourniquet spin loose. And that again is just another simple knot. When we're done with that, we have a secure tourniquet and controlled bleeding. But we have to remember, make a notation of the time that the tourniquet was tied. That's very important. The other important thing is to call 911 because right now this arm is at risk for having tissue death if we don't get this person right to the ER.
Mr. Harvey? Mr. Harvey, it's Mia here from Social Services. I have your lunch. Oh. Did you have a fall?
Oh, yeah. I slipped on a rock.
Are you okay?
I think I might have broke something
Okay.
there.
Can you tell me where it hurts, Mr. Harvey?
Well, up in my leg here.
Okay. I'm going to do a quick scan of your body to make sure there's no broken bones or any visible bleeding.
Okay.
Okay. We have the chest area, arms, the chest, your feet, legs, and what about this?
It hurts. Yeah.
Okay,
Oh,
okay,
yeah. Oh,
so
yeah.
you've
You
got-
got that right there.
Got some pain in the hip.
Oh, yeah.
I'm going to go ahead and get a blanket from inside, keep you warm.
Okay.
And I'm going to call 911 and get an ambulance here so somebody can check up on it.
Okay. Much
Okay?
obliged.
Is this your dog?
That's Leo.
Leo, okay, cool. Leo.
He wouldn't hurt a flea.
Okay, we'll have Leo stay with you and I'll be back in just a moment, Mr. Harvey.
All right. That's a deal.
Got a blanket here. How are you feeling?
Oh, okay. I'm just sore.
Gonna be good.
I was a little...
Okay.
Dang it.
What a day to garden.
Oh, started out beautiful.
Okay. Well, Mr. Harvey, I called 911 and somebody's coming in an ambulance right now. They're gonna be here really soon, and I'm gonna stay here with you and Leo until they come.
Oh, thank you, dear.
Yeah, we'll get you checked on in just a moment.
Okay.